Glass, awesome. All right, hey everyone. This is Kyle Samani. I'm here at Health 2.0 representing HIStalk here with Aaron Levie, founder and CEO of Box.
Hello.
So Aaron, there's a lot of big news for Box today for the healthcare world. Enlighten us, please.
Yeah, so we have Box helps businesses and individuals store and share and manage and access their information in the cloud. And we started the company 8.5 years ago as a purely horizontal provider of services to let you get a file from your mobile device or share and collaborate across any kind of geography or any kind of network. And what we saw was Box was being used more and more in the healthcare industry in a lot of different environments, in hospitals and pharmaceutical companies and the research field. So earlier this year, actually in March of this year, we announced that we were HIPAA compliant, and that was an effort that we undertook at the beginning of last year. And what that allows us to do is to go in and work in a compliant way within all of the kind of major spaces in the healthcare industry. And that was the first announcement we did earlier this year. And we followed that up with a number of new partnerships that we're working on. So we work with now CareCloud, we work with Informatica, we work with Dr. Chrono to be able to help you extend content that you have in Box out to the other applications that you're using and allow those services to store more information in a secure cloud environment. So we announced those partnerships, and we also announced a new app challenge with Dignity Health and Social Plus Capital, which is a major VC in Silicon Valley. So we're really excited about the innovation happening in the healthcare space, and we want to be a vendor that can bring new kinds of technology to the market.
So if I understand this correctly, it's effectively almost like a shared folder between provider entities and patients and other middlemen labs and stuff?
Yeah, so it can actually be used in a variety of ways. That's absolutely one. But you can think about it just as the file system that you have on your desktop, but now it's in the cloud, and it can be used for a lot of different purposes in the healthcare space. So anything from medical research, where you want to be able to have doctors and patients and researchers working together, all the way to patient kind of care and education delivery, so being able to store information in Box and then extend that out to patients. So there's a lot of ways that we're working with the industry to be able to use the cloud to drive better outcomes in healthcare.
Very, very cool. Are you guys focused on any particular types of files or any particular use cases, or are you letting your application partners really drive those?
Yeah, we see most of the innovation is going to happen at the layer above Box and the layer above our platform. So our job is to go in and build the deepest and sort of most horizontally or universally applicable technology, and then allow developers and third-party partners to extend our technology into the healthcare space in lots of different ways. So we're going to see most of the innovation happen because of the, eventually hundreds or thousands of developers in the ecosystem that we'd like to work with.
Very cool. So let's talk about how you guys became HIPAA secure. From what I understand, Box actually runs their own servers.
We do.
That's really interesting. Yeah. How did you guys get into that? Why don't you use Amazon or Microsoft or anyone else?
Well, we actually do use Amazon as well. We have fault tolerance that gets delivered by Amazon, but we are in an interesting situation where we actually started the company before Amazon Web Services. So we started the company in 2005, and back in 2005, the only way that you could build up your infrastructure was to manage your own servers. So we built a competency, and what we realized was that actually ended up giving us a huge strategic advantage to go work with large enterprises, where we can introduce compliance efforts and security and auditability that wouldn't be possible if all of our primary infrastructure was being delivered by Amazon. So it's something that we've been doing now for 8.5 years, and it remains as a really strong competitive advantage today.
Very cool. So what are the plans looking forward for this platform? You guys have announced a few partners. Is the goal just to sign up as many as you can? Or is there any other strategic direction you can kind of outline as far as where this is going?
Yeah, I think, again, there are a few categories on top of what content and information is being shared in the healthcare ecosystem. So if you think about, again, patient education, if you think about being able to allow for research collaboration, if you think about the connection between medical universities and hospitals and the sharing that goes on between those environments so they can drive for better outcomes over a longer time horizon, all of those are the types of things that we want to be able to solve. And so those are the ecosystems that we're going after from a developer standpoint. So we're working with EHRs, we're working with communication apps that are building better communication tools. You'll see us work more in the analytics space over time, and those are generally the categories that we're going after right now.
Very cool. So your number one competition here is definitely non-consumption, right? Which is like faxing and other very stupid forms of communication.
Yes.
That's relatively obvious.
No offense to faxing, of course.
And yeah, particularly the faxing. Who is your biggest digital competition, if any, or who do you think is going to be pretty shortly coming after you guys?
I think we see two situations. We see very complex software that is sort of over serving the market. So they've sort of built too much functionality to go serve this space effectively, and that would be like Microsoft SharePoint or Documentum. So deep content management tools, or insecure consumer tools, and that's the sort of polarization that we've seen in this industry. It's either stuff that's either too complex or stuff that's not secure or compliant for the industry. And what we're trying to do is have the right level of compliance, the right level of security for the healthcare space. So a major pharmaceutical company, a major healthcare institution, a major insurance company can use our platform, but it's as simple as the consumer tools that you're used to. And that's generally what we're going after. And so our competition tends to be on either ends of those poles in the ecosystem.
Very cool. Do you see them either moving up or moving down market in towards you guys?
Or
any other entrants?
Well, it's very hard to move down market. Once you've built a very complex solution and you have a lot of embedded processes in your software, it's hard over time to reduce functionality out or improve the design or improve the capabilities. So we actually don't see that the deep enterprise incumbents will move down market, but we're always paying attention to low-end disruptors that could be more disruptive over time.
Very, very cool. So any other interesting thoughts from the HIStalk audience?
I think the elephant in the room is your Google Glass. Probably. I think I think that wearables and this ability to bring computing down to the point of transaction is actually going to be extremely powerful. So when you can get computers next to what you're doing in the actual job that we're doing. So it used to be that computers were sort of almost separate from where we were actually doing the work. You'd sort of go back to a computer and pull up information, and then you'd go do your job.
Doctors complain about those EMRs all the time.
Exactly. And so to be able to have the delivery of information at the point of patient care, or at the point of, in other industries, a construction site, we think are going to be very powerful. And we think that will have a big potential impact in this industry. So that's something that we're really excited about. I think we'll see more and more innovation happening in this space over time. And we're obviously very happy to support it with an open platform going forward.
Yeah, we're doing Google Glass for surgery, so there's definitely opportunities to feed data.
Absolutely. We should find a way to work together.
Awesome. Cool. Well, hey guys, thanks so much. Aaron Levie again. This is HIStalk and Health 2.0. Cool.